Good morning. You guys caught me making my coffee. Yes, I was making my coffee this morning. We have a special guest for Morning Brew with Germaine. And yes, it is Mixed Blend Wednesday. So I am super excited because we have someone in studio with us today that's really going to be able to help us in the area of healthcare. So give me a moment. Let me kind of get this together. I'm sorry. Getting it together. Okay, let's get into this. So, today's brew is going to be about faith, business, and most importantly, the main topic navigating changes in healthcare. And I have founder and CEO of Best Choice Medicare LLC with us today. Yes, we have Edward Williams in studio with us. But give me a second before we bring him in. I just want to tell you a little bit about him and pretty much what we can expect in today's morning brew with Germaine. So, as healthcare in the United States continues to shift, as we all know, and as we're seeing this, and a lot of people that we love are being affected by it, understanding how to navigate Medicare options, coverage updates, and insurance reforms has never been more essential. So, Edward, or as we call him, Ed, he's an entrepreneur, he's an ordained pastor, author, and founder of Best Choice Medicare LLC. He's bringing over 20 years of experience in the insurance and financial services to this critical conversation, known for blending faith, ethics, and business excellence. Edward has built a company rooted in integrity, trust, and client education. So, in this episode, we'll unpack how Best Choice Medicare is helping clients make informed decisions, what changes and shapes the U.S. healthcare system today, and how purpose-driven leadership can redefine the future of insurance and care for seniors. So let me not let him wait any longer. Let me bring him on.
Hey,
Good morning.
good
How,
morning.
how are you, Ed?
I'm doing wonderful. Hope you are also.
I am. And this is such a powerful message that needs to be heard today. So many people right now have no idea how to navigate healthcare and the changes that are happening rapidly. So I am so thankful to have the expert in studio today that's really going to answer a lot of the questions that we need answered. So,
I'll do my best. I mean, I've been out here in the trenches for a while now. And just to let you know, the whole thing about this government shutdown and everything that's going on right now,
yeah.
the linchpin or the biggest component of what's causing the friction and the opposition and the adversarialness of it all is healthcare.
Wow. So people want to know. They really want to know. And you know what? We all probably have someone that we know, someone in our family, someone that may be a friend, or we know someone that's being affected by these changes. And it's only going to get worse, I take it, right?
Absolutely, because what I'm saying is a trend where the companies, and I'm appointed with all the major companies in the states that I'm licensed in,
Okay.
and all of them they're all like in concert limiting benefits that used to be provided. Little extra benefits like dental and vision and grocery money and stuff like that. Those kind of little extra benefits are starting to go away now.
Mm, the things
Yeah.
that really matter, the things
Yeah.
sometimes we don't even think about because we just expect them to be there.
Exactly.
Oh,
Exactly.
wow. So tell us a little bit about you. What was your passion? What drove you to really want to focus on this area? And you've been doing this for 20 years now. So you don't
Yeah.
even think about it. You just wake up and it just happens.
I kind of just fell into it. I owned a mortgage company for 15 years. And
Mhm.
when the mortgage industry crashed, I always like to say when the mortgage industry crashed nationally, it crashed and burned in Detroit, Michigan. That's where I was then. I'm born and raised in
Okay.
Detroit, Michigan. And it hit Michigan and our company so hard, it basically bankrupted us. So I
Okay.
had to look for a transition career wise. A lot of my properties were upside down. Upside down means that you owe on them more than what
What?
their value is. And so when that thing crashed, it hit so fast, like a tsunami. It hit so fast, it took a lot of us out. So I had to look to see, and I had to seek the Lord as, okay, so what's my career now? I mean, because I've been doing this and I'm totally vested in this, and now this is totally gone away. And so, I was just led by the Spirit, the Spirit of God, because everything I do is based upon my relationship with the Lord. So let's get that out.
Absolutely.
Let's get that elephant out of the room. I'm a
It's not an
believer. I
elephant to
love
me.
Jesus. He loves me. This is what I do. And the Holy Spirit, that little soft voice told me, said, "Go get your insurance license." I'm like, "My insurance license? What I want to do that for?" And I just, being obedient, I went and got
That's
my
right.
insurance license, and just started working in the field. I started really doing life insurance mostly.
Okay.
But life insurance is a tough sale, and it's a hard life, because what happens is when a person gets life insurance, they know they need it. Just like a lot of people that are going to be listening to this call, they either have it or they're embarrassed because they don't have it because they know they need it.
That's right.
And what happens is when they have a little tight moment in their life financially, the first thing they stop paying for is, guess
It's
what?
the insurance. Their
Absolutely.
insurance, their life
They'll just
insurance.
let it go. They'll just let it go. And so I transitioned from that and started actually getting trained and appointed in the Medicare space for health
Okay.
insurance.
Okay.
Yeah. And an opportunity actually came my way where I was exclusive, and I was working with a product that had never been done before. It was a Medicare insurance advantage plan for people on dialysis. And so I was
Okay.
working with a company called Fresenius Dialysis, and I was the loan rep in Raleigh, North Carolina, for a plan that they provided to their dialysis patients. First time ever done. Great plan, because prior to that, a person on dialysis could not get what's called a Medicare Advantage plan. I can go into
Okay.
the details of what that is whenever you're ready. But it was a good plan, but it ended. And so that's when I got into the main space of Medicare Advantage plans and Medicare supplements. And I can explain what the difference between those two are
No,
too,
go
because a lot of
ahead.
people are confused. Okay, so what Medicare does, Medicare is the insurance that's provided by the government, and you've earned that. You've worked at least 10 years in the system, or 40 quarters, as they say. And through that, you've paid into the Medicare system. And so when you turn 65, you're
Mhm.
automatically enrolled in Medicare Part A. Medicare Part A covers you for
Okay.
any hospitalizations, hospice, and a couple other things like that. And then you can pay a premium and get Medicare Part B. Medicare Part B covers doctor visits, labs, x-rays, and any kind of little medical procedures and stuff that you might need, but you do pay a premium for that. So that's
Okay.
Medicare A and B. Then there's Part D, which is prescription drug plans. And in a Medicare Advantage plan, it's included. That's why it's called a Medicare Advantage prescription drug plan, MAPD.
Okay.
And the difference between that and a supplement is, now Medicare Advantage plans, most of them are zero premium. So they don't cost you anything monthly, and they offer, like, they turn that 20% that Medicare requires. Like, if you're on just traditional original Medicare, you pay
Mhm.
20% of whatever medical service or whatever medical procedure, whatever medical office visit or whatever. You'll pay 20% of the cost of whatever that is. A
Okay.
Medicare Advantage plan helps cover that by turning that co-insurance 20% into co-pay, which means with a Medicare Advantage plan, normally you don't pay there's no copay for seeing your primary care. And then there's a small copay, maybe $20 to $40 for seeing any specialists, heart doctors, diabetes
Yes.
doctors, whatever. That's where the Medicare Advantage plan gives you an advantage. That's why it's called an advantage plan, right? Because it helps keep your costs manageable.
Okay.
It's not free, but it keeps it manageable, and it turns that 20% into something. Because you go to a specialist, instead of paying a $40 copay, which is manageable, because you know that's all you're going to be exposed for that visit, regardless of what they do.
Okay.
If you're just on original Medicare by itself, 20% of what? 20% of whatever they're charging, whatever they do during that visit. That visit could cost you $2,000. That means you're paying,
Exactly.
$200 for that visit. So it just that's the difference. And so now there's Medicare Advantage plans, which I just kind of gave you a little
Mhm.
nutshell. But then there's also Medicare supplements. What a Medicare
Okay.
supplement is you pay a premium, and it could be anywhere from $100 to a couple of $100 a month. But what that Medicare supplement does, it pays the entire 20% of whatever your medical cost might be.
Okay.
So you have to pay a premium for it, and you also have to buy your prescription drug plan separately. So you may pay another 30 to $50 for that prescription drug plan. So your exposure is more as far as your costs, but you're covered more comprehensively, if that makes sense at all.
It does.
So
It
those are
does.
the two choices when it comes to, well, three choices when it comes to Medicare. Let me make it simple, and then we can move on.
Okay.
The first is you just stay with original Medicare,
Mhm.
and you're exposed 20%, and you buy your prescription drug plan separately. So you're still going to pay a little monthly cost of anywhere from 20 to $50 a month for your prescription drug plan. That's
Okay.
one. That's option number one. Option number two is a Medicare supplement where you pay a monthly premium and you pay your prescription drug plan, but you have no cost, whether you have a hospital stay, doctor visit, tests, labs, anything like that. It's all covered, but you pay a monthly premium. You'll probably be between $100 and $200 a month. Or you have the third option, which I really specialize in, and I kind of promote more heavily, because a lot of people don't have the budget, especially my seniors. They don't have the budget in their fixed income for $200 a month for a supplement. So they'll pay Medicare Advantage plan. You pay zero monthly premium. You
Okay.
get, it covers you for office your primary care visits. It covers you with a small copay for specialist visits, and then a lot of your other medical costs, like a hospital stay or emergency visit trip. They're kind of manageable because they're reduced to copays as opposed to co-insurance.
That is a lot of information,
It,
and
it it's
I
it's
want
deep.
to know, how do you navigate with um your clients, or even introducing this to new clients that all they want is the end result? How do I get to this?
Well, what I do is I usually they know that they want a Medicare Advantage plan or not when they talk to me. I write mostly Medicare Advantage plan. I'll write a few supplements for people that have that in their budget, and they
Okay.
just don't want the headache of paying anything. So they say, I'll pay $200 a month to make sure I don't have any kind of medical expenses. Plus, that's for somebody who might have a chronic condition, a severe chronic condition, where they know they're gonna incur a lot of medical cost.
Okay.
Yeah. So the supplement might be better for somebody that, one, that they have it in their budget, but they have chronic conditions. They might be diabetic and on dialysis, or have a heart condition or something like that. They may want something that's going to be more comprehensive because they know that they're going to be using a lot of medical, they're going to have a greater medical need.
Okay.
Yeah.
So how is that being affected right now? For those that are watching the news and seeing things being affected with healthcare, how is that being affected right now for them, especially if the government is supposed to supplement Medicare or medical and they're taking it away? What does that look
Yeah.
like?
Well, I don't know if you've been watching, but they're talking about almost like defunding
Yeah,
Medicaid,
exactly.
and then Medicare. They're talking about limiting the amount of money that they're expending on Medicare. So it's gonna hit, as far as those costs are gonna get passed on to the consumers. Period. I mean, that's basically what it is. And I really feel for
Oh
my
God.
Medicaid community. A lot of
Yes.
times people don't understand the difference between Medicare and Medicaid. Medicare is federal. That's the one that I told you that you pay into and you
Medicare.
get it
Mhm.
granted when you turn 65. Now, you can get Medicare under 65 if you have a qualifying chronic condition. Lou Gehrig's disease, ESRD, which is end stage renal disease, which is kidney failure, dialysis, and cancer. If you have one of those, you could qualify for Medicare even at a younger age. I have teenagers on Medicare. Okay.
Okay.
Because they have that, they're either on dialysis or they have that Lou Gehrig's disease, ALS
ALS.
disease, and those qualify for Medicare, regardless of age. But
Okay.
Medicaid is a state program, is state by state, and it's based on income. If you're under a certain amount gross monthly income, you can qualify for Medicaid. And Medicaid actually kicks in and covers what Medicare does not cover as far as medical costs. But you got to
Wow.
be pretty broke to get Medicaid.
Well, I want to say, okay. And it's a lot of people out there that's in need of that,
Yeah.
and they're taking those
Well,
rights away.
well, I was listening just this morning. I was looking at some reports, and they're talking about totally defunding Medicaid.
Yeah,
They're
like
talking about taking
wiping it.
billions of dollars away from Medicaid.
So I have a question, if I can interject while you're on this topic. Diana Knox Cooper says, "Where's all the money that has been paid into it? What happens as people are paying money? I guess they don't care. They're still taking it away."
Yeah, that's a good question. I mean, the rich get richer, right?
I guess that's what it comes
Rich,
up to, because I don't understand the
yeah.
logic behind it. I mean, that's
No,
just really to harm and hurt people.
yeah. Those are the people that we put in office.
Exactly. That's the
Yeah.
thing.
So I mean,
So once again,
we we
no, go
got to
ahead.
do what we got to do to make sure that we start being more mindful about who we're putting in office. And it better start now, because we've made some mistakes. We got some representation and some people that really don't care anything about us. You know.
That's a valid point. And I've been talking about this whole power series, really knowing our power. And a
Hmm.
lot of times, I don't know, do we take it for granted that we don't really know the power we possess? And what we're starting to see is, yes, there's power in our vote.
Yeah.
Because for so long we were told, oh, it doesn't matter, our vote's not going to be counted and all that. But right now, unity of people coming together and really going to the polls when it's time locally. We don't understand the
Mhm.
value of local voting. So when you just talked about Medicaid is local.
Yeah. It's
Is that
state,
state level?
state by state level. Yeah.
There's a lot of elections that's getting ready to take place. And it is so important that people become more mindful for what your rights are and who's fighting for your rights.
Yeah. And my thing is this: you can look at what a person says that their platform represents, but you better look at the heart of those people.
Yes.
That should be the determining factor. What kind of character? What kind of person is this? Are they a believer? I mean, are they compassionate? You got to look at who that person actually is, because they can put on their platform what they think you want to hear to get elected, and then they get in there and they change into who they really are. So we need
Well,
to know who they really are before they get in
exactly.
there, because
What
it's
we're
hard to get them
doing,
out once they get in.
that's it. And we're seeing that right now, how all these changes are happening in less than a year. A
Hmm.
lot of these systems are being affected in less than a year.
Yeah.
So I want to clear something up. Diana Knox Cooper said, I mean, the money is being paid in. So why cut our money that we pay in off? Why cut it off? And you know what? If I can say, and then Ed, you can chime in, I just think it's purely greed. I think it's a whole different conversation behind the scenes that we will never be privy to, with these billionaires that are in positions to do exactly what they're doing right now, because clearly we voted them in office.
Yeah.
And then some people were appointed that we didn't vote in, you
Hmm.
know, but they just don't have any regards for we
Exactly.
the people at
Yeah.
all.
Yeah. Yeah. And so I mean, that's where it's got to start. I mean, but the thing is, again, being a believer, I see a lot of this that's happening as stuff that was prophesied and that is got to happen anyway. So, I mean, how much we can do is, I mean, I don't know.
But that's a valid point. That's a valid point. And we're still talking about the pretty much healthcare, but I am on with Ed, who is a believer, who actually you align your belief system in with what's happening with healthcare, to really be able to enlighten and bring knowledge and information to the individual.
Yeah, my
So
wife always says that my Medicare clients are my congregation.
I love that.
And
And
they
you know
really are.
what?
I pray with my clients. I pray for them when they call me. What's important to them is important to me. I mean, I go to bat for them. I was on the phone with CMS, which is the Centers for Medicare and Medicaid Services. I was on the
Yeah.
phone with them probably the last couple of days, probably 6 hours, trying to fix some things for a couple of clients that glitched in the system, and their benefits were being canceled out and held
Oh,
up,
wow.
and I mean that the system is just it's a monster. It really is. It's not easy to navigate, and you get people that are not that well trained. They don't know what they're doing. They don't know how to fix stuff, and it's amazing. It really is.
And you still stand on the front line fighting.
Absolutely. What else am I
But
gonna do?
I love that what your wife said, that
Yeah.
it's your congregation. I love that because it's not, you don't have to be in a four-wall building in a church behind a pulpit. You are in the streets, you are in people's homes, you are
Yeah.
really helping to make a change in people's lives. And I heard you do you deal a lot more with seniors
I
versus,
do.
okay, that's your biggest community, dealing
It
with
is.
seniors.
It really
What are
is.
some
Yeah.
of the stories that you're hearing that are people conscious and aware right now of what's really happening when
No.
it comes to healthcare?
Not really. Just like now for the information for the plans that'll be available in 2026 for Medicare, they're coming
Mhm.
out now. So I'm looking through them for the various companies that I'm appointed with: United Healthcare, Cigna, which just turned into HealthSpring, Aetna, Humana, Anthem, Blue Cross Blue Shield, all the big boys. I work with all of them. I see what their plans are. And for all of them, they've made cuts to the benefits that used to be available. Like they used to give out grocery cards with their
Mm,
plan. They no
okay.
more. Really, I mean, that's like slim to none for 2026. Okay. Um, dental and vision. They make cuts regarding what the plans will help cover for those services. I mean, so they cut back a lot, and people are no, they're not that aware because when they tell me, well, I need a plan next year that's gonna pay some groceries for me. And when I
Mm,
try to tell them that what was available for 2025 and past is that's forget about that, because those just really kind of don't exist unless you're in a very slim category where you have Medicare and Medicaid,
mhm.
and full Medicaid. Those are pretty much the only plans that are, or a severe chronic condition. Those are the only plans that really are going to provide any type of grocery benefit with their plan now for next year.
Wow.
And people don't
So
know.
people
People,
don't know. Do you
no.
think in your engagements, encounters, and you sitting down with people of all different ages, do you think they want to know? Do you think they care, or is it still a thing where it'll be fine? That type of attitude.
Yeah, I think that we get to the point where we just go along. We just kind of, okay, well, that's what it is. Then that's what it is. And I mean,
How do we
kind
change
of
that?
that's yeah. I
How do
mean, the situation kind of dictates you got to take what you can get, right?
Mhm.
Yeah. So people have kind of just become a little complacent with that, and it is what it is. My job is to look and to analyze according to what their qualification is, what plans they qualify for, and find out who offers the best for that. Give you an
So,
example. If I got
okay.
somebody there's a chronic health plan in my market right now that does give like over $300 a month for groceries, pay utility bill, whatever. That's pretty substantial.
That's
For
good. And they
and
haven't
for a
touched
person
that
on a
yet?
fixed yeah, and for a person on a fixed income, that could be crucial between them
Absolutely.
eating well or decent and not eating at all. So, but that plan, you have to either have chronic heart failure, diabetes, or be on dialysis.
Those are the three.
It's
Anything
a
outside of that, you
You
will
won't
not
qualify. It's
qualify.
it's called a chronic special needs plan. So you have to have one of those chronic conditions to be able to qualify for that plan.
Oh, wow.
Yeah.
Well, what do we do? And this is the thing. You can bring people to water, but you can't make them drink, right?
Yep.
I guess people will make changes when they really feel the pain of a thing.
Yeah. You know what we have to do though, Germaine?
What do we have to do?
We
We want to
have to
know.
become less dependent upon the system. We
Yes,
have to be more proactive in our health care than just depending upon what a doctor says or what the scientific medical community advises. We do, because that's set up basically to keep us sick.
absolutely. Let's talk about that because that's solution based. So, not being dependent. And what's interesting, all these years you find yourself becoming dependent and then they take
Mhm.
it away because they have
Yep.
that power and control over you. So now you're left feeling like, what do I do now? Where do I go? And how can we fix this?
Yeah.
So let's talk about some solutions that can really help people navigate through this new way, this new
Hmm.
health plan, health system. And this is just the beginning.
It is. It is. And I mean, we got to get to a point where we again have to be more proactive in our health care. We got to walk. It's simple things. We got to walk. We got to eat better and more sensibly. Drink water, not sodas and sugar and flour. And I mean, my wife's like very naturopathic. And I'm drinking a
Mhm.
smoothie right now. This is what I
Yes,
do in the morning, every morning. I'm
love it.
69 years old. I mean, don't let
You
the
look
camera
great.
fool you now. I'm not a young man, but
You look great.
thank you. But I've always, God has blessed me, because even when I didn't know, I was what you call an unconscious competent. Because even
Oh,
when I didn't know, I took a route of proactive natural health care type of regimen, even when I didn't know what I was doing. And so now that I've become educated and more well versed in it, I know not to eat a whole bunch of sugar, because that could lead to diabetes. I know not to eat a bunch of flour products. Limit the consumption of meat, and just more fruits and vegetables, more green vegetables, more
yes.
supplementation. I do sea moss. I don't know if you're familiar with sea moss.
Yes, yes,
My
absolutely.
wife makes our sea moss because it's so
Oh, nice.
expensive to buy it in the store. Yeah,
Exactly.
you got to have her on, so she can
Absolutely.
so she can
Mixed
help some
Blend
people.
Wednesday. Mixed Blend Wednesdays is just that. So if I could
Okay.
just make a little shameless plug, on Mixed Blend Wednesdays, we bring in the experts to really talk about their area of expertise, to be able to educate. So when we're talking about health, like today, we're talking about the healthcare system. We
Hmm.
have our leadership coach that comes on every month. We have doctors that's going to be coming on, lawyers. So it's really being able to equip the people through Mixed Blend Wednesdays.
Yeah.
And people are finding value. And I want to say this. So Gloria Williams,
Hmm.
that's why I'm launching a health and healing ministry. And the thing is, people need a support system.
Yeah.
Gloria, thank you for that, because people definitely need a support system. I always say people don't know the how. Like, how do I do this? Or they don't know where to go to get it. So I think we're coming into a time, it's going to be really educational based because people are going to be starving for it.
Yeah.
There's going to be such a need for it, but it's up to the people to pay attention. The information is out there. You
Hmm.
have to want it bad enough for your own being, for your health, like we talked about. You have to buy into you.
Yeah.
You have to make you a priority, you
Yeah.
know? And I always say, you know what? It may be a lot of billionaires running this country and that's trying to strip us of everything.
Hmm.
But guess where our power lies? You
Hmm.
still have the power if you want to spend your hard earned dollars with those companies, with those that are trying to harm you and hurt you. And all they want is your money.
Right.
And I shared, Ed, on one of our shows, the power is in our dollar, because we as a people, Black people,
Hmm.
16 to 18 billion dollars a year we spend,
Right.
and it's not circulating in our community. There is something really wrong with that picture.
Absolutely. Absolutely.
And so solutions,
Yeah.
solutions.
So now,
CMOS is the bomb.
yeah, it is. Now back to let me say this before I forget and make sure that I
Go
put it
ahead.
in so people know. Look, during this season, during the Medicare season, our seniors are gonna get just besieged with calls and solicitations to do business here, do business there. And my thing is this: I always recommend that a person use a broker. If not me, somebody like me that represents all the companies. Because say if a person gets a call from Humana, guess what kind of plan? The only plan that they're trying to sell them,
Is
Humana.
a Humana plan.
Humana might not be the best one. So
That's
you need
right.
to get with somebody that is experienced and expertise in all of the plans in your area across the board. And then they can honestly let you know competitively which one would be the best situation for you to be in for the year, the upcoming year.
I ditto that. I ditto that because me and my husband, we're both entrepreneurs. We both have owned our businesses for I'm going into 18 years and he's going into 15 years. And the thing is, we don't have a company that's providing healthcare for us. So we have to go out and find healthcare. And we
Hmm.
use a broker. And it's one of the best decisions we could have made that really released us from trying to figure it out on our own.
Yeah.
So absolutely. But now I did get a question from Deborah. Deborah wanted to know, which states do you work with?
I'm in Georgia, North Carolina, and Michigan. But I
Okay.
can I can get appointed in any state though. It's just a matter of
Really?
paying a fee and it takes a couple of days, really.
Did y'all hear that? So I need you to put in the comments if you want Michael to be not Michael. I'm sorry. If you want, that's my broker's name. If
You
you
try to
want
give Michael my business.
if you want Ed to be your broker, um, I'm loving what I'm hearing from Ed. I might need him to be a broker here in Connecticut. But if you are someone that's interested and you need a broker, just put in the chat, put in the comments, even after this video, and say you're interested in even having a conversation with him and what that could
Yeah.
look like for you. So we'll make sure we provide your information also. Um, but who you good? Because this is heavy. I
It's a
mean,
lot.
this is a lot that you
It's
are carrying on your
it's a lot.
shoulders.
Yeah. Let me tell you something. And to stay in this business every year, I have to get like recertified with every company, which right now I'm with 6 companies. So I have to get
Okay.
recertified with all 6 of those companies. I have to retest to show them that I know their products and still have the Medicare insurance knowledge necessary to be proficient and professional every year. And then I have to take the federal test, what's called the AHIP, which is the overall test for all licensed insurance agents and brokers. So I mean, it's a lot. It's a lot.
It is a lot, but you are so committed, I see. Because it's more I'm sensing this is assignment. You are doing an assignment. You are in your God-given assignment work. And you know what? Insurance just happens to be the vehicle that you stepped into, but this is your way of reaching people, really reaching them, educating them, and helping them to have a better value of life, or
Yeah,
really being able to, I don't know, people, please just start paying attention, because
yeah.
people work real hard to make sure you are good, even if you don't see that. It's
We
up to
gotta.
you at the end. It's up to you as the people.
Yeah, we have to learn how to use the system because if we don't, the system will use and abuse us.
Can you say that one more time, Ed?
We must learn how to use the system properly because if we don't, the system will use and abuse us.
Whew, and they're abusing us right now
Yeah,
for their
absolutely.
greater good.
Mm-hmm.
I
And
hope we all see they don't care
they
at
are
all.
basically getting away with murder.
Yeah. Oh my gosh. And that's literally what's happening.
Hmm.
People
People are
can't
dying.
survive this.
No, not at all. People are dying, for lack of essential goods and services and products and services that they need. People are actually just dying.
Wow. Another way to control population, also.
There you go. Yeah.
There's always something working behind the scenes that we're not paying attention to.
Mm-hmm.
A lot of this, I think, is smoke and mirrors, because we're not paying attention to what's really happening behind the scenes. So I am so glad you are enlightening us on what's happening,
Yeah.
and you're staying in tune to continue to bring the information to the people about what's happening and how they can benefit. But I can't stress enough, it's really up to you, the people. You have to want it. This is a
Yeah.
matter of life and death.
It is. It is. And my advice is just make sure that you have that professional that conversation with a professional if you're in the Medicare space, let's make sure that we make the best choice for 2026. Because once you lock in on that, you're stuck with whatever plan that you decide to get. The
For that
open
whole year.
enrollment season, or what's called the annual enrollment period, AEP, is from October 15th through December 7th. That's where you get to pick the plan that's going to start January 1, 2026 and last throughout that year. So let's make sure that we're in the best plan for our situation. And you got to look at various factors. Do you need a plan that offers more dental because you got some denture issues going on? Do you need a plan that possibly will give you some grocery and utility money because your budget is tight? Do you need a plan that's giving you some vision? Do you need a plan that's going to be the least expensive for hospital stays or doctor visits because you're going to require quite a bit of that? So let's analyze and look at your situation, and then let's make the best. Let's pair you and fit you with what the best option is, whether it's a Cigna or an Aetna or a Humana or whoever. Let's talk with somebody that has information from all those companies is not committed to one or the other, but can actually make your best decision for the plan that would be the best fit.
I love that. You know what I want to do is post your information. How can people reach you? What's the best
Email
way?
and phone. I'm actually having my website worked on right now, but
Okay.
right now my they can just call me on my cell phone. I talk to people every day. I tell you, this is my congregation. 470
Hold on one second. I'm typing it in right now. 470
421 3588.
Okay. Is there an email address also?
It is. My email is Eddie, EDDIE, Darell, DARELL, @gmail.com.
All right. Eddie Darell @gmail.com.
Yep.
All right. I am posting that for all things healthcare.
Yeah. And I mean, even if somebody's in a different state, if they have a question or something, I'll still, to the best of my ability, try to.
I love that.
Yeah, try to help them with it.
And you never know, he may also become licensed in your market.
Yeah.
Sometimes it's just a phone call, right?
It is. It's just an online form. I fill out an online form, send them a check, and they good.
Wow, that easy.
Yep.
Listen, don't be surprised. You might be a broker here in Connecticut.
Okay.
So what is it that we need to know before we come to a close? Because we still got some things to talk about. But what is it that the people really, they must know?
Don't trust everything that you hear and see. Analyze it and discern it and do your own research to make sure. Just like I was at the doctor the other day. Because I'll still go and if there's something bothering me, or whatever, I still want to hear what they got to say. Or sometimes you might need an X-ray if something's going on inside that you can't see. You might need to get an X-ray. But now, what you're going to do with that information, that's what's important. I still encourage people to be more proactive and start trying to seek a more natural approach to their healthcare and stop being so dependent. I mean, if you look on the commercials that are on TV, and we're just flooded with pharmaceutical commercials.
Exactly.
They're coming up with symptoms and health challenges, and they're coming up with medications every other day with all these funny names, and they just smiling and everything. But if you ever listen closely to those list of possible side effects, because a lot of they'll even throw in the one that could lead to possible stroke or death. I mean, whoa! Why would I? but that's a whole nother conversation. But I just really just want to encourage people to be more proactive and more hands-on with their own health and stop just taking it. Ask your doctor. Yeah, you can ask him, but that don't mean you got to just believe blindly and follow blindly everything that he says.
That is so true. I'm so glad you brought that point up because the one thing that always scares me, I'm not so quick to take medicine if I don't have
Yeah.
to, even if they
Hmm.
want to. It's like, okay, there's always those side effects that concern me. And
Yeah.
God bless, I have family members that sometimes 15 pills at a time.
That's
There
and
I mean, how is that not breaking down the body? How is
exactly.
it I mean, I don't even see with all these side effects, it's like you're a walking side effect, with all that
Yeah.
medicine.
And there's no way to measure the potential side effect from combining this with this. Now they may have done some research and said, well, if you combine this one medication with this other one medication, it could possibly cause a side effect of this. But if you're talking about one, two, three, four, five,
6, 7,
there's nobody
there's
out
no
there
way.
measuring what the potential side effect would be from combining all these toxic substances together in your body.
One of my family members, she's been diagnosed with sarcoidosis, chronic sarcoidosis. So they had her on so many pills. She finally
Yeah.
got into the Mayo Clinic and they
Hmm.
had to literally detox her whole system
I
from
bet.
all of that medicine, and it took a long time to
Yeah.
purge her system of all that to really get her on things that were better to really be able to help her. But it's scary because everything becomes this money grab.
Yeah.
And the people become the guinea pigs, to
Absolutely.
get you on the next new thing. And we got to be more conscious and aware what we're putting into our bodies.
Yeah. And Gloria actually has a cousin who healed herself from sarcoidosis.
Oh my gosh. Oh my
She sure
gosh. We need
did.
to have, yes,
Yeah,
we need to
yeah.
bring, yes. Now, Gloria. So Gloria, you know what? She did put a message in here with her contact information. I'm going to post it,
Hmm.
Gloria, because we may need to talk
Yeah.
about. I love the idea of just what she's looking to start, but being able to have a roundtable discussion, even those, because I mean, that's definitely a conversation. My sister was diagnosed with sarcoidosis also,
Mm.
you know,
Okay.
and you finding it's happening more. So, oh, definitely we need to let's have a roundtable discussion on some topics, but I definitely have to bring you back, Ed.
No,
So,
anytime. Glad to do.
yes, absolutely. As a
Yeah,
friend, a guest, a friend to the Morning Brew with Germaine, someone that we know we can call on at least once a month or so, right?
absolutely.
Because there's going to be so many different changes going on. People just need to stay in the know. So,
Hmm.
all
And
right.
where's the
That,
information for me to do the cups of coffee that I'm donating to the show? Because
oh,
I really enjoyed speaking with you this morning. You definitely worth it. So just let me know
oh
where. You can email it to me or whatever, and I'll make sure that I support the ministry, the show, and make sure that
you're going to bring me to
your coffee
tears.
is supplied.
You're gonna bring me to tears. I'm gonna put this
Nah,
up on the screen. So he's
you
really
doing
gonna
good
bring me to
work.
tears.
You do it. Look here, and Nehemiah talked about how when they tried to distract him and get him down off his work, he said, I'm doing a good work right now. I can't come down to you, so I want to help you stay on the wall."
Oh my gosh. So what I do, I have the way people can support Morning Brew with Germaine is we have a partnership through buymeacoffee.com/morning brew with Germaine. But I'm
Okay.
gonna take if you have, I'm gonna take a moment and I'm just gonna play this for people for those that want to support. And you know what? I say as little as $1 a day. They
Hmm.
can really be able to, it's called Buy Me a Coffee, but the donations go back into the platform just to be able to have a voice and give a platform for those to be able to share like Ed has today, and really knowledge and information that we need that's going to help build us as a people, right? And so
Right.
let me play this clip real quick, and thank you so much for saying that. Hold
Oh yeah, absolutely.
on. Welcome to Morning Brew with your girl Germaine on You Buy helps fuel inspiration, conversations, and creative content for our growing community. So grab a seat, Stop by for a coffee break. Sip with us. And thank you so much for pouring into purpose with me. Morning Brew. I'll see you in the next coffee break. So, with that, it gives people a way, and I'll put up the QR code in the corner. Let's see. It gives people a way to be able to just say that, you know what, I really value the information that you're sharing with us, and we want to see more from you. But I really appreciate you
Oh yeah,
for even mentioning that.
I appreciate this opportunity to just talk and try to inform and help educate some people. Because my thing is, there's another scripture that says, "Try the spirits." It's time for people to start trying them daggone doctors too.
Listen, you know what? I said I wasn't really going to say anything, but I'm thinking about my own personal doctor's appointment and going to the doctor and just trying to see, okay, I need to really get my weight under control and all that. And the one thing they want to do is let me put you on Ozempic because I'm a representative from Ozempic or Manjaro or all these different ones. And so, but the thing is, they'll start telling you and putting in your notes, okay, this, and this, so you can be approved for certain things. And I'm saying, wait a minute. Now you're creating my file and it's saying I got all these health issues. And it's like, where's that coming from? Just to get me on a medicine?
Yeah. Yep.
I am so thankful. And I kept saying, because I was really challenged, like, God, I'm not feeling this. I'm not feeling this. So he said, no, we'll give you some samples. We'll start you out on some samples. And what's so interesting? I was doing it wrong. So I wasn't even getting what I needed in order. And so when I went back to him, he said, you didn't finish the vials. And I said, I don't know. I guess I misunderstood. I was doing it wrong. But I just said, God, you know what? He knew I was wrestling and I was struggling with it. And that was the end of it. So I said, I will learn to do it naturally. I will learn to do it healthy. And so, but that's my walk, nothing against anyone else out there. But I have spoke to some of my friends that's been using the weight loss. They look amazing. But what's interesting, they don't know how to get off it now because they're afraid that it's going to put the weight back on, or they're dealing with some mental and psychological, emotional things with going through that process. So, you know what? I mean, is it worth it when you think about it? Because it brings a lot more than they talk about.
Yeah, yeah. And anytime you're introducing something toxic into your system, it's gonna cause you can have for different people because we all have different constitution, different, we're all different. It could cause some side effects or some different outcomes that are exclusive to you, because of your constitution and how you're made up. So you got to be very, very careful, and that's why when they give the disclaimers, they always say possible side effects. Well, it's possible that one person might get this, but another person might get this, or another person might get all of it. But yeah. Yeah, so that's what we got to be very watchful for, And again, like I say, try the spirits, and anything that they talk about trying to put me on or give me or whatever, I look up the side effects, and usually by the time I see that, I'm like, nah, I'll figure out another way.
But we need to do more of that though. We need to really invest more in what's good for us, because one thing doesn't fit everyone.
Right.
But I love that. Wait a minute. I gotta stop and I gotta take a pause here, because Gloria, you keep coming with it. Menopause hit me during COVID and my weight stacked, but now I am naturally burning fat. Menopause is a whole nother conversation that we will be having a guest come on to really break it all down. She is a registered nurse and she's been, years in that space, but that's something the healthcare industry, they don't even really talk about. They don't get into it. I don't even think doctors know a lot about it. So they stay away from it. But we're really dealing with it. And men go through it also.
Yeah.
It may not be called menopause. So with that being said, you have really enlightened us on, and you just scratched the surface. That's why he will need to come back to Morning Brew with Germaine, because
Be
he's
glad to
only
do it.
scratched the surface. There's so much more that we need to know. So, in any parting words, what would you like to leave with the people?
Just that let's be proactive with our health, and let's be proactive with making sure that we talk to a professional that represents the full range of companies and products and services out there, so we can have the best decision the made with us and for us and by us based upon pertinent information. So I'm talk to a professional that's a broker.
Yes.
Don't just take that telemarketing call from one company trying to sell their one plan, because that's not in your best interest. So that I would just
I love that.
recommend that we take time to really survey what's out there in our prospective areas. And then, too, a lot of times people they'll have a cousin or an aunt or somebody in a totally different state or a totally different county, tell them that they're getting this, and and it may not even be applicable for them. you,
That's
you know
absolutely. So, pretty much, don't take everything as gospel that you hear from people that may not be well versed in what's happening in your state,
right.
because you did say this was state by state in a lot of
State by
cases.
state, yeah. And plans are state by state.
So, where can people go? I mean, for the states that you're not in, is there any general information, like people can go online to find out more? Where can they go to just find
Med,
out more information per state?
M- Medicare.gov.
Okay.
Yep.
Okay.
Medicare.gov.
Medicare.
They'll put their zip code in, and once they put that zip code in, it will pull up the companies and the plans that are available in their area.
All right. I just want to put that in the thread where people can visit
Hmm.
and pretty much find out more information about what's happening in their state.
Yep.
So, thank you. Do you listen? We'll work out a schedule so we can have you on at least once a month or maybe once every 6 weeks, whatever works. But right now is the season because, like you said, open enrollment is about to happen come
Hmm.
October 15th. And so you're constantly learning new information about what's going on with healthcare. And so we definitely need your voice. We
Thank you.
need your
And
voice.
the trip is this. This is definitely God ordained, because I was really going to retire. I wasn't even planning on working this year. And
Really?
like that line in The Godfather, every time I try to get out, they pull me back
They
in.
pull me back.
I have more business this year than I probably had in the last 5 years, and I didn't even ask for it. I got a company that called me and said they wanted to give me 100 appointments.
Oh, listen, that's favor though.
You know,
That's
I got a
favor.
I got a dental office that has this dentist that has 3 offices, just out of the blue called me like, I heard about you, man. I saw your flyer somewhere, and I need you to come and be the rep to help my dental client. It's
Oh,
massive. It's
I
ridiculous.
love
I
that.
actually made Gloria. She's working on her insurance license right now because I need more help.
Yes,
Yeah.
that's right. Keep it in the family, right?
Hey, she's
But
smart.
I
She
love
here.
that. You know what I love about that is because you're a business owner and you said you were looking to retire
I
and
was.
not really carry that load. But I guess your assignment is not done yet.
It's not. I'm.
It's being exposed to even more people that need you at such a time as this.
Yeah, and I love helping people. I love
I
making
can see that.
sure that we made the right decision and we got them the best that they could get, and helping them ease some of that pressure of life that people are going through, especially our seniors.
Oh wow. And I mean, they need it. And you know what? A lot of things are being targeted right now towards our seniors. And
Hmm.
so, but it's a lot of noise out there in the atmosphere. It's a lot of noise. So
Yeah,
you have to navigate through what is going to work for you.
yeah,
And but I am so glad you did not retire. And I just want to thank my executive producer Charles Williams, who actually brought us together
yeah. Thank you,
because
girl.
yeah, thank you, Charles. But your voice is so necessary. And I definitely got to make sure I get your wife on so we
Okay.
could talk all things health we'll continue the conversation, and we'll just pivot in a different direction, bringing some solutions and everything. But let me say this. Deborah says we have to, let me put this up. We have to get back to basics and get away from all these chemicals. Yes,
Absolutely.
that's killing us. It's killing us
Agreed.
slowly.
Yep. Yep. Then you
Yeah.
gotta have me and Gloria on sometime. You know, we both
Oh,
musicians,
absolutely.
singers, and writers. We got products and
Listen,
music that's slamming
listen.
out there.
You wear many hats.
Many
Many
hats.
hats.
Yeah,
Now, do you have any projects in the market?
we do. You can go
Talk
to Ed.
about it.
You can go to Ed and Glow,
Hold
GLOW.com.
on, hold on. I'm typing as you're saying. Visit www.ed glow
Uh-huh.
GLO
GLOW.
GLOEW.
No, GLOW.com.
Okay, GLOW.com.
Mm-hmm.
Yes, please stop by.
Yeah. If you need a prosperity anointing, listen to the track we did called Checks in the Mail. People
Ooh,
listen to that. We've had testimonies. People have listened to that song and have gotten checks in the mail. Okay. And we've
ooh.
definitely gotten checks in the mail from writing it and putting it out. And it's a really good song too. So
Hold on, I'm typing that. I'm directing people where they should go while they're there, right? So thanks for
mm-hmm,
the recommendation. Checks in the mail.
mm-hmm.
Listen, I am a firm believer, and people might think I'm crazy, but my faith is just that crazy. But I'm a firm believer. Money grows on trees and it falls from the sky,
That's right. There you go.
and it will
Absolutely.
definitely show up in the mail.
Mm-hmm. Sure
Oh
will.
my gosh. And this has been such a joy. It has been such a joy for you to just share some time on this coffee break with me. So thank you.
Well,
Thank
thank
you.
you. I'm honored that you would select me for being a guest and being able to talk and help inform. I hope some people really benefited, and I know they
Absolutely.
did. And that we're
Absolutely.
gonna just trust God that some changes, necessary changes and improvements will be made, and we look for positive outcomes only in Jesus' name.
Amen. I love that. And on that note, we are going to go into our segment, which is the final sip, whereas we bring things to a close.
Okay.
So I just want to say, in a nation where healthcare is constantly evolving, Best Choice Medicare reminds us that knowledge is power and
Hmm.
integrity is the best policy.
Absolutely.
Yes.
Absolutely.
So, with that being said, thank you. Thank you for chiming in and stopping by for coffee with me. So, we will definitely be bringing you back to Morning Brew with Germaine. And we'll also bring you back so you and your wife can tag team. Okay.
Okay.
But I thank you so much. And until we meet again, and thank you again also for supporting Morning Brew with Germaine. This is our first encounter. And so my heart is full. It really is. People have no idea. I'm a crier. So,
Yeah. We got you.
but thank you so much. And as you all know, you can stay tuned to Morning Brew with Germaine Monday through Fridays, 10:30 a.m. Eastern Standard Time. And on Fridays, we have Authors Brew Friday. So we bring an author in studio and we have dialogue conversation so they can share their story. Because as you know, there is power in your story, and your
Absolutely.
story is currency. It is. Somebody needs to hear it. So thank you so much. And we will see you tomorrow, Morning Brew with Jermaine. Have a great day. And
Thank
please
you.
be safe. In this information, go back and play this again, because I'm quite sure there's something you missed that you could take away with or share the information with someone else. So make sure you stop by YouTube at Morning Brew with Jermaine, and make sure you subscribe to join the community and get your notifications, and hit the like button. It deals with algorithms, I guess. I'm learning all this stuff, but I'm
Yeah.
having fun while I'm doing it. So
All right.
thank you so much, Ed, for being a
Thank
friend
you.
to Morning Brew with Jermaine. And guys, be safe out there.
All
Goodbye.
right.
Have a great
You
one.
too. Thank you. All right. God bless. Yeah.
Bye bye.